I'm just going to be talking about airway management, because when the patient is, for example, it's an emergency situation and patient cannot breathe for him or herself, we have to be able to provide positive ventilation. So first, looking at some of the important things you may need for airway, we have a non-rebreather mask. We also have an ambu bag, which may have to use to provide positive ventilation to the patient in case the patient cannot breathe for himself. But at times the patient cannot really breathe completely, and maybe the tongue is sticking all the way to the back of the throat and blocking air from going down to the lungs. In that case, we may have to use either the oral airway or the nasopharyngeal airway. When do we use the oral pharyngeal airway? It's when the patient is, if the patient is fully unconscious and the patient doesn't have gag reflex, that's when we use the oral pharyngeal airway. And they come in different sizes, and before you use it on a patient, you have really to make sure that you have the right size of the OPA you are using. And the only way you can know that you have the right size is you have to measure from the corner of the mouth to the angle of the jaw. So that means from the tip of the mouth to the angle of the jaw over here. So in this case, for our patient, Mr. Patient, if you put the OPA, you see from the edge of the mouth to the corner of the jaw, it's exactly fitting. So that means once you put it, it's going to be the perfect one for this patient. Because if you put a short one, that means you'll not be able to get the results you wanted, to take the tongue off the back of the throat. And the same thing applies to nasopharyngeal airway. This is how it looks like. And when do we use it? For this one, we use it for the patient who is maybe semi-conscious. Also, if the patient has a gag reflex, we may use this one, because if we use the oral OPA, the oral pharyngeal airway, the patient may end up vomiting upon you. So we don't want that to happen. And the same thing is this one comes in different sizes. The only way you can know that you have the right size is you have to individualize it to your patient by measuring from the tip of or one of the nares, nasal nares, to the corner of the earlobe. So that means you measure from here, just the one measuring, to the tip of the earlobe. So in this case, you can see that it's completely fitting well for our patient, and that's what we are going to be using for our patient, Mr. Patient. We'll start by demonstrating how to use the oropharyngeal airway, the OPA, and this is how it looks like. I'm measuring from the tip of the corner of the mouth to the edge of the jaw. It's the right size. And when I'm inserting it, one, you are going to turn it to make it face up, and you use what do you call it?
The scissor motion?
Yeah. So use the scissor motion to open the mouth while your oral airway is facing up, and then you put it in, and then once it's in, then you turn it 180 degrees, and then it's all the way in. So if you had the right size, it should be taking the tongue off the back of the throat. And how do you know that you have really provided the right size and you are providing the right function that you wanted it to do? Is when you start ventilating the patient, one, air should be going down to the lungs. When you start bagging the patient, the only way you know that air is going down to the lungs is you are not facing any resistance. Two, you are getting a chest rise on your patient. So that means our OPA, oropharyngeal airway, is in the right place. Now I'm going to demonstrate how, let's assume this is out. Okay, I'll take it out. Now our patient is back, is conscious, and is talking. We don't need it anymore. But now maybe it's calling again, and then this time our patient still has a gag reflex, and maybe it's kind of a little bit semi-conscious. In that case, we may have to use the NPA, nasopharyngeal airway. Still, I have to individualize the size I'm using to my patient, measuring from the end of the nose to the end of the earlobe. So, like you can see, that's the right size. So, to prevent causing damage to the nares, nasal septum, I have to lubricate my NPA device that I'm using. So, I have put some lubricant, and I choose one nair to use, and when I'm inserting it in, it's going to go just the one inserting it while using a twist motion. You have to make sure that you are not facing any resistance. If you face any resistance, stop, pull it back a little bit, and then try to move, adjust it that way you don't face any resistance, because if you go against resistance, you may end up causing trauma inside the septum, and if you cause bleeding, you may not be able to stop it easily since it's inside. So you advance it all the way. So for the purposes of this demonstration, this one may not go all the way in because our mannequin has a problem in the nose, but let's assume it's all the way in. So if we put it and we put our NPA in the right location, it should be taking the tongue all the way off from the back of the throat. And that means when we start bagging this patient, know that it's in the right place. We shouldn't be facing any resistance. And as you can see, the more I bag, the more we see the chest rise. So that means we have our NPA in the right position, and we are getting our purpose of providing air support to our patient. So some of the things we have to know is we have to remember that we have to protect ourselves. Like we have to do hand hygiene. You must be having your gloves. And I mentioned before, sometimes maybe, especially if you are using the oral OPA, oral pharyngeal airway, the patient may end up vomiting. And to protect yourself, you must be having a mask. Put on a mask. You should also wear goggles. And definitely you must be having gloves, because you do not want to either to transmit your whatever kind of dirt on your hands to the patient, or you also don't want to be get infection from the patient. At the same time, when you are opening the patient's mouth, if you don't have gloves, maybe the patient may end up, your hands may end up getting like a bruise from the patient's teeth, and you may end up getting an infection. So other things to remember is that when you have the nasopharyngeal airway in place, it makes it easier to suction the back of the throat for the patient without having trouble like causing trauma to the nasal septum. Why? Because the NPA, there's a hole in between, so you can use your suction, like the small suction you can use to suction the trach. You insert it through this hole, so it comes all the way to the back of the throat. Let's assume this is inside the patient. Then it's going to suction out all the secretions, that way opening up the airway and making it easier for the air to go inside the lungs when you're bagging the patient.